Dr. Marty Makary is a professor at Johns Hopkins University School of Medicine and a Fox News contributor. Great to have you back on the program. Look, I know that we are following the science and the facts. I'm curious as to why the White House looks like it's not. And I say looks because of the optics of President Biden.
Well, there's going to be a lot more contradictions. You know, the public perceives a low risk out there in the community, and they are correct. And I think what you're going to see is more and more guidance that's out of step with the real risk level out there. Also, people are getting frustrated that the goalposts are being moved. Remember, the outstated goal to get back to a normal life and remove mask restrictions was less than 10 cases per 100,000. Half the country is there right now, Harris. About a dozen states have less than 7 cases per 100,000. So when people see the goalposts moved and they see the CDC moving 2 to 3 months late consistently on every major issue of the pandemic, there's going to be a lot of frustration out there, and political leaders are going to need to respond to that.
A Wall Street Journal op-ed argues that lockdowns didn't stop COVID-19, citing a recent study that found more virus spread inside homes than workplaces. So we've known this all along, but now there's even more evidence of it. The op-ed is reading in part, there is little doubt that infection would spread faster in congregations than in smaller groups if both engaged in similar practices. But since larger groups have an incentive to spend on expensive methods of prevention, larger organizations might be better at prevention than households with fewer people. Dr. Makary.
Well, it raises a good point, Harris, and that is when you tell people they can't do certain things and they need to stay at home, people don't just stay at home and live with their immediate family members and not engage in activities. They do things differently, and they're more likely to do them in indoor gatherings where there may not be the same ventilation or precautions or distancing or mask requirements that you have at the workplace. So this study is telling us things we've already known. And rather than look back, I think at this point, we need to acknowledge we've made a lot of mistakes. When we told people to stay at home, we should have told them to get outside. When we told people to wash their hands like crazy, we should have told them to mask up at a time when the infection risk was high.
All right, we'll move to this. More teachers are sounding the alarm over the effects of remote schooling during this pandemic, and educators are now warning kindergartners may never fully recover from the learning that they have lost. One North Carolina school district official wrote this: kindergarten cannot be replicated even by the very best teachers in the virtual environment. A missed, delayed, or low-quality kindergarten experience could impact this generation of kids for their lifetime. Dr. Makary, your thoughts on this and how the science really plays a part in this. How do we know this?
Well, gosh, this is really frustrating because we know that the research is finally going to catch up at some point with the restrictions that were put into place. That happens after every major natural disaster, any major event in the country, be it a hurricane or some major public health crisis. We finally get the research that shows that the restrictions or the implications were far worse than we thought. We saw this after Hurricane Maria in Puerto Rico, after Katrina in New Orleans. And this is telling us today, the study, that we may need to change the curricula, that there's a year lost. You don't just make up for that. And maybe we need to start things off differently. I'm concerned that in August, we're going to have a massive national debate erupt around a perception of risk, even though that risk is low. And that debate is not going to be a healthy debate. It's going to, again, allow political influences to come in.
Yes, we follow the science and all that. How about selling it with the science and the facts? Sell them. I mean, why are we at a place where people don't even believe what they should believe because it's right there and it's real?
I think two things. I think we have a completely distorted perception of risk. Right now, if you look at COVID daily cases and new hospitalizations, we're about 1/10 the level of a mild flu season. And the case fatality rate is similar now that COVID is in younger populations. We are well below the levels of a mild flu season right now, and yet the perception of risk is disproportionate. Also, if you dismiss natural immunity, as we're hearing from our public health officials, almost as a way to manipulate people to say we've got to get to 85% vaccinations in order to have a normal existence, that's ignoring natural immunity. The reality is nearly 60% of U.S. adults now have been vaccinated, and about half of those unvaccinated have natural immunity. That puts us around 80%. That's why the public perceives a low risk in the community, and they're correct.
Well, and the reason that that fits into this conversation about children in school and kindergartners in particular and how much work we need to do is because we anticipate, based on what you just said, there's no reason why we can't flip a switch and responsibly go forward in our journey, get back to some things like school full-time, so on and so forth, expeditiously. A new piece in the New York Times says that many families are hesitant to return to school, Dr. Makary, because of the changes they've made this year at home. Quote unquote, teenagers from low-income families have taken on heavy loads of paid work, especially because so many parents lost their jobs. Parents made new child care arrangements to get through the long months of school closures and part-time hours and are now loath to disrupt established routines. Some families do not know that local public schools have reopened in their areas because of language barriers or lack of effective communication from districts. Your last word on this.
Well, I think there's an entirely different perspective from somebody who's wealthy, who's got private tutors, who has a good lifestyle during COVID. COVID has been good to a lot of people. A lot of people have been renovating their homes during COVID. But in inner city Baltimore here, it's been a very different story. Remember, it's very hard to keep kids in school pre-COVID, and COVID has really distorted that entire ability to get kids in school and keep them in school.
Dr. Marty Makary, thank you very much for your time, your expertise, and your science.
Thanks.